One of the best diagnostic methods that was ever developed was an AMAS test.
AMAS, yes.
And that was approved by the FDA in 1978. The caveat with the AMAS test is it will tell you if you have cancer, but it won't tell you where the cancer is. But the reason it's so accurate is most of the tests we have for cancer, if you're not doing a CT scan with contrast, etc., or a biopsy, are called cancer antigen tests, CA19A, as an example, CA19. It's cancer antigen 19. The problem with these tests is so many factors can affect their outcome. If you have an inflammatory process going on, if you have an infection going on, you can show positive in these. The AMAS test, what it stands for is anti-malignant antibody screening. And this actually testing for antibodies to malignant, which are given off, malignancy came from that term, malignant, because all cancer cells give off malignant. Your body produces antibodies to malignant. Antibody measurements are much, much, much more specific and accurate than antigen tests. So you think everyone in the world would be going, it's a simple blood test.
Right. Nope.
No biopsy. You don't have to worry about opening a tumor wall and seeding the rest of the body with cancer cells. You don't have to worry about any of the problems involved or any of the mistakes involved in cancer antigen tests. Never used. You can ask oncologist after oncologist after oncologist after oncologist, do you do an AMAS test? And they'll say, what's that?
They've never heard of it.
They've never even heard of it. The reason that it went into disfavor was for the body to be able to produce antibodies, it had to be able to have an intact immune system. As soon as chemotherapy was started, they could no longer follow it.
Immune system shot.
The immune system's no longer capable of producing these antibodies, so the test is useless.
So they will never use the test because they'll never stop using chemo.
That's true.
Too much money.
There's far too much money.
Speaking of the antigen, though, that reminds me of a topic that we've discussed before. Talk a little bit about the PSA test for prostate cancer, and the fact that it's not even necessarily, that stands for prostate-specific antigen.
Right.
And it's not even necessarily prostate-specific because women can have high PSAs and they don't have a prostate.
Anytime you see an A after a test that stands for antigens, be very skeptical, because PSA does stand for prostate-specific antigen. However, in many different types of cancer, and breast cancers, for example, in women that have no prostate, will have elevated PSAs, which means it's not a prostate-specific antigen.
It's kind of like the Federal Reserve, right? It's neither federal nor are there any reserves.
Right. That's a good analogy. It's neither federal nor are there reserves. It's neither prostate-specific, and it's not reliable at all.
Right.
It's no measurement of anything.
It's a measurement of inflammation, isn't it?
The doctor that developed it and I had dinner one night, many years ago, and he was actually remorseful that he had developed that test, because he was aware that as cells became compressed, it would increase the prostate-specific antigen. And a lot of things can cause this compression of these cells. And a bacterial infection can raise your PSA, of the prostate I'm talking about now. A fungal infection can often raise your
certain over-the-counter medicines.
Some over-the-counter medicines, some prescription medicines can. Another thing that most people don't realize, I've touched on it briefly before, and that's how estrogenic males are becoming. And the more estrogen that's in the prostate, the higher the PSA will be. So using prostate-specific antigen as a test for either the progression of prostate cancer or diagnosis of prostate cancer is totally BS.
Yeah, and that comes from the mouth of the man who developed the test, basically. I mean, he did in not so many words.
And he's written.
Yeah, I quote him in the book about the PSA test and how he believes that it's kind of a bogus test now. It just measures inflammation, but it should not be used to diagnose prostate cancer.
No, and on the other hand, the AMAS test I discussed with you has over a 98.7% accuracy test with breast cancer, for example.
But it's not being used.
You won't be able to get...
Well, they don't want to stop you from getting that mammogram.
No.
Mammogram is far too lucrative of a business.
And every country now that started using mammograms heavily, with the exception of the United States, of course, we're the only one of the few countries that use GMO foods as well.
Mm-hmm.
They do honest studies. Many countries outside of the United States, medicine is not so much a business as truly a healing art. And they look at these facts. Unfortunately, the large pharmaceutical companies are now influencing more and more and more of these countries and sliding them. But mammography was shown to actually increase the rate of breast cancer. And especially if you're having a mammogram every year. That's a...
Well, it's cumulative radiation.
Yeah, most people don't realize that radiation is cumulative. Just like fluoride is cumulative.
Right.
It's a neurotoxin, and it's cumulative. In other words, the longer you take it, even if it's a small dose, it will accumulate in your system to the point where it will cause harm.
Right.